The Women's Heart Alliance and Women Heart launching a national campaign to encourage women to get their hearts checked as COVID-19 increases the risk of stress and heart disease.
Well, Denise Valdez is here in studio to tell us more about it in today's Health Watch. Denise.
Well, heart disease is the #1 killer of women in this country, but over the past decade, awareness of it has really declined. A lot of women simply don't realize the threat or know the signs. And now, with COVID, two groups really want to raise awareness of just how prevalent and severe heart disease can really be.
I will be right by your side.
The national campaign, Women Can Have It All, Even Heart Disease, from Women's Heart Alliance and Women's Heart, sounds the alarm for women to check their heart health. CEO Selena Gore is concerned about the rising rates in young women, especially women of color.
First thing to do is check your blood pressure. Know what that is. Know what normal is for you. That's really important so that when you see variations, you know that something's not quite right.
With so many worried about COVID, we're often overlooking the bigger threat and killer of women. The campaign urges them to schedule their screening. So your doctor will study a number of things. How's your cholesterol? Do you have a history of hypertension, diabetes, other risk factors like smoking and drinking? And this is a biggie. Have you had any symptoms? Because they may look different for men than they do women.
Indigestion, nausea, unexplained and extreme fatigue, and weakness. These are symptoms that we see more often in women. And it's really easy for us to dismiss those symptoms because they are so generalized.
Unique symptoms like jaw pain and backache are also highlighted in the public service announcement. Some of the other risk factors that if you have, let's say, an autoimmune disease like lupus or rheumatoid arthritis, early onset menopause, or have undergone cancer treatment. Now keep in mind, 12 times as many women die of heart disease every year than they do from breast cancer. By the way, Women's Heart is the nation's only patient-centered group, and they're dedicated specifically to serving women living with or at risk for heart disease. They've got a lot of great resources online.